Now you know why I'm going last. This is not a TED Talk. This is a talk about Ted. And Ted just had a trauma, as you can see. Let me back up to that picture. Oh, never mind. Is Ted going to develop heart disease? What's the odds of somebody developing heart disease? Look at two people to your right and look at one person to your left. They will succumb to heart disease. All right, unless you're on the end row, then that doesn't count. Prior to me getting into healthcare, I worked for the U.S. Department of Energy and Nuclear Weapons Engineering Facility. And in fact, I worked at the facility Dr. Margolis talked about, where plutonium, uranium, and all this complicated stuff, but nowhere near complicated as my friend Ted over here. Okay? So my talk today is not a health talk. It's an engineering talk. And it's going to require you to think, as you see here, a little differently about your health. I've said it before, and I'll say it again. Your health is defined by two things: biochemistry and biomechanics. And you have to optimize both of those if you're going to optimize your health. Okay? Let's talk about biochemistry. For those of you that are mathematic majors and whizzes and like formulas, that formula at the top there, that's how many reactions occur in every single cell of the human body every single second of the day. And Mr. Ronald McDonald loves to play havoc on that process, by the way. And so that number equates to 37,000 billion billions. That's 37 with 21 zeros behind it. That's complicated. And you've heard a lot of great advice about what to do with these reactions as they occur within your body and actually govern your health. The other side, the biomechanics side of what we see. Oddly enough, there are 360 joints, mechanical joints in the human body. And that's not where the name of this group came from. But 360 mechanical joints. And when I say the word mechanical, that presents a problem. Because as you can see with my friend Ted, we have traumas. So when we start talking about mechanics, we also have to talk about physics. And if you talk about physics, you have to include mechanics. Mechanics is the branch of physics dealing with the study of motion. When's the last time you went to Home Depot and you're trying to find a normal parking spot? And you can't because the first 10 rows are all handicapped parking spots. They're not handicapped parking spots because you have high cholesterol or you have insulin issues. It's because you can't move. Physical, the root word physics, physical disabilities. And my friend Ted here looks like he's going to have one. Okay? So when we start talking about engineering and physics, we get into laws, like the law of gravity that's holding you in your chair right now. But the one law, as we talked, some of the other speakers talked about, the aging process. The aging process in engineering is called the second law of thermodynamics. It's the law of entropy. And that law of entropy states that everything goes from order to disorder. Everything. Your shoes, your toothbrush, the air conditioner, the seat you're sitting on, the stage that I'm on, right? And your health, biochemistry-wise and biomechanical-wise. So, entropy is the second law of thermodynamics. It's entropy that I want to hammer in your head today. So if you want to write one thing down, one word from this presentation, it's entropy. Because if you can control entropy, you can control the aging process. The picture up here on the left. This is the front of the spine. This is the back of the spine. The spine is the most mechanical entity in the human body. It is subjected to all the physical laws that we see with our automobiles and air conditioning units and everything else. But most doctors are not teaching patients that they are mechanical. So when we look at this picture here, when the vertebrae are mechanically pushed forward, now I want to emphasize that because grabbing the neck and going, or the low back and going, is not pushing bones forward. When we move bones forward, they will interlock with one another. When they do, they create those open diameters. That's where the nerves will branch through from the spinal cord, which is right up against the back of the bones. When we get into trouble, those bones are going backwards. And when they go backwards, what happens to the opening? It becomes narrow. And this is what I published my second book on. That's spinal stenosis. Spinal stenosis is not a disease. It's not degenerative disease. It is structural mechanical malalignment. We use the word stenosis in the engineering profession. I heard about it way there before I got into the healthcare profession. When we have this problem, then we will see degenerative disc. We will see degenerative changes as a result of that. That's called Wolff's Law, or the bone remodels. But the thing I want to talk about is that this process from here to here is entropy. Entropy can be a sudden trauma like my friend Ted went through, or entropy can be constantly putting your body in flexion, the way you exercise, the way you sit in a chair, the way we look at our phones, and flexion. Flexion is killing you. Flexion is tied into heart disease, and I'm going to tie all this 360. As you can see right here, when we age, does our posture get better or does our posture get worse? And I love going to the airport. I love to get there way early and watch people. And I'm analyzing them biomechanically. And the majority of people I see, that's happening right there. That's entropy. Okay? So the real question is, where do those nerves go to? Once they are impinged from biomechanical trauma, whether it's minute trauma, which we call micro trauma, or macro trauma, like my friend Ted just went through. Those nerves, according to Gray's Anatomy, this is Neurology 101 chart, go to every single organ and gland in the body. And then what we're here talking about today is the heart. The nerve that controls the rate and rhythm of the heart comes from the upper thoracic spine. Okay, this is not a belief system. It's not something you have to imagine. This is basic anatomy and physiology 101. Okay? Nerves in the lower back go into digestive issues, prostate problems, a whole host of problems. And so this was a study that was done in 1921 by Henry Windsor. And this is what he wanted to know. When a bone mechanically shifts out of place and impinges a nerve root that innervates an organ to control its physiology, will there be adverse pathophysiology in that organ? Pretty straightforward. He had 200 cadavers, and that means they were dead, by the way. You don't know what that means. And he put them in piles. I would hate to really taken place of that study. But 25 of those 200 died from heart disease. And so what he wanted to know was, if I open the fascia, the muscles, and I look at the spinal column for structural malalignments, in the area that Gray's Anatomy tells us the nerves innervate the heart, will I find mechanical chaos there? And what do you think the answer was? How many of the 25 did he find structural malalignments there? All of them. So then this study was repeated 3 times. It was funded by the University of Pennsylvania. And as I said at the beginning of this study, in 1921, it was published in the Medical Times. Who hates that kind of information? Pharmaceutical companies, of course, right? I want to read this one more time. You're probably wondering, why did I put the slide up there twice? This is what he published. Organs supplied by pinched nerves reveal pathological disease changes. The more serious the pinched nerve, the more serious the organ damage. I'm going to bring this from 1921 to current day. Organs supplied by impinged nerves from spinal stenosis cause diseased organs. Okay? And who else agrees with me? Here's Gray's Anatomy. It says the nervous system controls, coordinates all organs and structures of the human body. All. Here is 6 cases I pulled out of my database of 9,000. And that's how many x-rays, biomechanical x-rays, that I've read over my 20-year career. And that number is still increasing as I've introduced 3 more to my team of biomechanical experts. What we're looking at is a structural malalignment. Whoop, not that fast. Right there, which is the number 5 thoracic. We're having heart arrhythmias. Well, here we're seeing at the 6th thoracic, we're having heart arrhythmias, and we have an enlarged aortic knob. What we're seeing right there is the 4th thoracic, aortic arrhythmias, heart arrhythmias. Down here, arrhythmia, arrhythmia, arrhythmia. All of these things, if I put them on top of each other and shrink them off the computer, they look like the same individual. I have thousands of these cases. These cases happen to be referred to me from cardiologists. Why would they send a case to me, right? Because cardiologists monitor the problem, I fix the problem. Here's 2 cases. See the wire, chicken wire where the sternum is? They've already had heart attacks. They look identical to structural malalignments right here. This guy was a 20-year paramedic in Orange County. He came to see me from LA because he's still having heart issues. He doesn't want to have a heart attack, doesn't want a pacemaker. What is a pacemaker? We're going to talk about that too. The more impingement on the nerve, the more pathological changes we will see. This patient was referred to me for arrhythmias. Couldn't figure out why he was having arrhythmias. And all along, as you can see, that's a lot more of an aggressive malalignment. Nobody caught the fact that he had lung cancer. And the same nerve that innervates the heart also innervates the lung. Is it coincidence? He has that much spinal stenosis causing pathological changes. He developed lung cancer. Didn't smoke his whole life, never smoked. Here's a case. Somebody was diagnosed with scoliosis. So, went to a chiropractor. Chiropractor went crack, crack, woom, woom, no x-rays, no exam. Then went to a physical therapist. Didn't go see Dana, although wish she would have. Ended up at an orthopedic office and ended up having 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 surgeries in which they fused the entire spine. Okay? The problem was when they put the last surgical rod in there, a Harrington rod, did they weld it with the bones in alignment or out of alignment? They welded it. It's like you driving your car to Pep Boys with the front end out of alignment, and they weld it in place so it doesn't get worse. To an engineer, this is absolutely absurd. And so guess what she developed? Super fit young female. She developed heart issues as a result of that. Permanent spinal stenosis. I've actually encouraged her to remove that. Here we have a heart monitor right at the top. In the middle, right there, same misalignment, heart monitor, same misalignment, pacemaker, same misalignment. The interesting thing is with this particular case is when I give a structural adjustment without twisting the neck off, but pushing the bone forward to open the diameter off the nerve to undo spinal stenosis in a systematic fashion, we can monitor the electrical impulses, the electrical conductivity of the heart changes. the very instant that I do a spinal adjustment. And more spinal adjustments, the more impingement is reduced, and the more electrical impulses travel to the heart. And after all, what is this thing? This is an artificial nerve controlling the rate and rhythm of the heart, because the real nerve has been damaged from trauma. Look well to the spine for the cause of disease. This is biomechanical work a long time ago. A long time ago. All right? And in case you're wondering where my beard, what look I'm going for, well, that's the guy right there.
The worst cavities I have ever seen. Okay, have a good day.
Aren't you gonna fix it?
Oh, I'm not a dentist. I'm a dental monitor. I just tell you when you have a bad cavity.
It's bad. Lunch?
Oh, yes.
Where are you going?
Why monitor a problem if you don't fix it?
Why monitor a problem if you don't fix it? There you go, Ted. Fixed it. I'll see you next week. Why? Why have a health problem if you can prevent it? Thank you.